Some things in life are much more fun to give than to receive. For example, it's more fun for a teacher to give the test than a student to take the test. The same is true for injections. It's much more fun for me to give the shot than for the patient to receive the shot. In this speech, I will demonstrate how to give an intramuscular injection. I have learned in nursing school the skills needed to do this process. I will first have to prepare the syringe and draw up the medication. Then I will prepare the patient and choose the correct site. And lastly, I will administer the shot. The first step in this process includes getting all of the needed supplies. That would be the correct needle and syringe size, the medication to be administered, which in this speech I will just be using sterile water, gloves, and alcohol prep pads. First, I will flip the plastic cap off of the vial and use an alcohol prep pad and swipe over the top of the seal just to ensure sterility. Next, I will remove the cap of the needle and insert it into the vial. I will inject the amount of air into the vial for how much medicine that I wish to withdraw. This allows for easier withdrawal of the medication. Next, I will withdraw the amount of the medication that I'm to give. I will remove the needle from the vial and ensure that there's no bubbles in the syringe. If there are, I will flick the syringe like this to ensure that all bubbles are out. Then I will re-scoop to ensure that I don't stick myself with the needle. Next is time for me to go in and meet my patient. If the patient's anything like me, the patient will be panicking and in a tiz. I will use therapeutic communication, telling them that it will be over before they know it. At this point, I will put on gloves and choose my site. For the IM injection, there are 3 sites possible. You can do the ventrogluteal, which is the hip, the vastus lateralis, which is the leg, or the deltoid, which is the shoulder muscle. For this speech, I'll be using the deltoid. I will take an alcohol prep pad and I will locate the acromion process. That will be my marker so that I will know I'm putting the injection in the right spot. I'll find the prominent area and go 3 finger widths below that. That's where I'll inject the shot. I will clean the area of the syringe, of the skin. We start in the middle in a circular motion and work our way out. Next, I will take the syringe, ensuring there's still no bubbles. Tell my patient that they might feel a slight sting. I'm going to insert the needle at a 90-degree angle. Next, I will aspirate this plunger, and I will look for blood return. If there's blood return, that indicates that I've hit a vein and I need to pull the needle out and not inject the medication. If there is no blood return, it is safe for me to inject the medication into the patient. Once it's been injected, I am able to remove the syringe and immediately place it into a sharps container. I will never recap the syringe because that places me at risk for a needle stick. If there's blood after I remove the needle, then I could place a Band-Aid on the patient. Most of the time that's not necessary. If it's a child, I could give them a sticker or a sucker to make them feel better. In conclusion, shots are not something that anyone really looks forward to, but it is necessary for our health. The steps in giving a shot include preparing the syringe, preparing the patient and choosing the site, and then injecting the medication. It is important for us to follow all the guidelines to keep the patient and the healthcare worker safe.